experiment. I just want to welcome all of you to NDP09 combined rehearsal. I'm Dr. Tan Mei Hui, I'm the Chairman Medical Committee. What we intend to do is to tell you a little bit about some of the preventive measures that we are going to that we have implemented for NDP09 and for preparation of NDP09. Because as you know, there's a bit of public interest on H1N1 preventive measure. So what we're going to do today is we're going to bring you on the work. We're going to show you some of these preventive measures. Basically, there are three groups of preventive measures. One is preventive measure prior to the rehearsal, and preventive measure during the rehearsal, and the third group is some of the additional measures that we have implemented during the rehearsal. Okay. The details are in the fact sheet, and I thought we can take the walk through the ground if you like, and let the measures speak for themselves.
I think maybe we just do a quick overview and run through it. Okay. When they see it on the ground, it's easier to.
Okay, what we're going to do is to show you three main group of preventive measure. For example, prior to the participant attending the rehearsal, for example, we have been seeking the cooperation of all the participant group and all the committee. What we are telling this committee is to tell their people that if they have been to some of these affected countries, if they are having flu or fever, or they have been to some of these local cluster area, and they are really not to attend the rehearsals. So that is the preventive measure, the advisory we have been giving to all the participant group. That's prior to the rehearsal. And on arrival, prior to their arrival, we have asked the participant group to, at their own level, screen for flu and fever. So they will do the health declaration to make sure that all their participants are well before they even leave their holding area to make their way to the floating platform. So that's the preventive measure we do prior to the rehearsal. On arrival, they will be screened for fever by thermal scanner, which we're going to show you later. They will be provided with hand sanitizer. They will be encouraged to practice personal hygiene. And on arrival, if they become unwell for some reason, they can report sick at any of the 5 medical centers or medical posts that we have located throughout the float and the F1 pit holding area, which we're going to show you, which you will see later. And what we have done for all these medical posts is they have adopted preventive measures in alignment with the national guideline. You will see that the medics and doctors are donned in full protective attire. And patients with flu and fever, they will be isolated. And if they are really not well, they will be sent home. Or if they are suspected flu cases, they will be sent by the dedicated 993 ambulance. So that's what they can do. If they are here and if they are sick, they can report sick at some of these medical posts. Okay, what are some of the additional measures over and above some of this national guideline we are doing? Okay, we'll be showing you some of this. Prior to the arrival of the participant, we will disinfect the entire F1 pit building. Cleaner will thoroughly clean out all this area, make sure that the place is ready to receive all these participants. And once they arrive, we make sure the place is air often. You'll see typhoon fan throughout the whole area. And the intent is really to ventilate and make sure the air is fresh and clean. We also provide hand washing points, which we will show you later. They are all conveniently located throughout the Pit 1 building for the participant use. We also make sure that the toilets are frequently cleaned. You will see public health messages throughout the venue. And the vendor and contractors are also ensuring that their workers are screened for flu and fever before they come to the F1 pit building. Okay, that's basically broadly 3 groups of preventive measures that we have adopted for NDP09 preparation.